Hello. As we consider contemporary issues in the future of pharmacy this week, our final week in the course, this may be perhaps arguably the most important contemporary issue that we'll think about in this video module, and that is provider status for pharmacists. You'll learn in the next few minutes that this is a major point of advocacy for our national pharmacy associations, and it really has some important implications for how we practice now and in the future. I want to begin this discussion by looking at a couple of documents, and I'm going to, I guess, apologize to you all right up front. I'm going to read several quotes from particularly this one that's in front of you now. This is a document called Improving Patient and Health System Outcomes Through Advanced Pharmacy Practice. It was prepared by the Chief Pharmacist of the U.S. Public Health Service, and it was a report to the U.S. Surgeon General. And the implication and the kind of the purpose of this report was to try to get the Surgeon General's advocacy for pharmacy practice, more advanced pharmacy patient care services, and acknowledging the role of pharmacists in medication therapy management. This report has been cited very widely in our field, and it really summarizes quite well some of the major things we've talked about in this course, the things that pharmacists are doing and the implications they have for cost savings and better outcomes for patients. I really would suggest that you take a look at this document if you can. I've linked it to our course website. It's an important contemporary piece. You can see here on our first slide that says that pharmacists may be the only health professionals who manage disease through medications and provide other patient care services who are not recognized in national health policy as healthcare providers or practitioners. We'll learn in the next few minutes what this means, what it means to be a provider, and why that is important. I'm going to read another quote from this piece to you. The chief pharmacy officer says, "Pharmacists are remarkably underutilized in the U.S. healthcare delivery system, given their level of education, training, and access to the community. One of the most evidence-based decisions to improve the health system is to maximize the expertise and scope of pharmacists and minimize expansion barriers to an already existing and successful health delivery model." So I want to think about some kind of bullet points that this document points out in terms of what are opportunities for pharmacists to help improve our healthcare system. And this report kind of puts them in three buckets. The first being their ability to help with chronic care. Now we know that in our healthcare system about 80% of all therapies involve medication. So we've learned already that medication use is the predominant form of medical treatment in this country. We also know that about 75 cents out of every dollar we spend in healthcare in the United States is spent on chronic disease conditions, diseases like asthma and diabetes, for example. These conditions account for about 81% of hospital admissions, about 91% of all prescriptions, 76% of physician visits, and 99% of Medicare spend. So if we can have more of a collaboration around chronic disease states, it can make a serious impact both in terms of outcomes and cost in our healthcare system. So this report to the Surgeon General advocates that we should think about using pharmacists in a stronger way in chronic care management. Secondly, they point out that access is an important factor with regard to pharmacists. We learned in our course that we are the third largest body of health professionals, so we have a large number of practitioners. We also know that we are located in sites where patients might have easy access, community pharmacies and clinics and hospitals as well. So in terms of access, we think about medically underserved populations. Are there places where pharmacists could help fill a gap? And also the growing need for primary care providers, because we know, as we think about the provider workforce with regard to primary care and vis-a-vis chronic care, that physician entry into primary care is dropping. Actually, since 1997, that has dropped about 50%. So we need to start filling in some of these voids in terms of the need for primary care and how that applies to things like chronic care. I'm going to read one more quote from this Surgeon General reports as we have this discussion. I'm going to read another one in a few minutes as well. So the report goes on to say this: integrating pharmacists into direct patient care results in favorable outcomes across healthcare settings and disease states. Pharmacists with larger roles in patient care improve outcomes, increase access to care, especially for medically underserved and vulnerable populations, shift time for physicians to focus on more critically ill patients in need of physician-based care, improve patient and provider satisfaction, assure patient safety, enhance cost effectiveness, and clearly advance and improve healthcare delivery. So I start off this discussion about provider status by kind of pointing out that this report to the Surgeon General of the United States, which has been widely utilized in these discussions, points out that pharmacists are prepared to do more, and that we have evidence that if pharmacists do more, they can have an impact on patient care. Another document that I want you to be aware of in this discussion of provider status for pharmacists is a document called Pharmacy Principles for Healthcare Reform. This is a 4-page piece that I will actually link to our course website. I would recommend you take a look at it. It was crafted and supported by 15 national associations and companies and puts the focus of pharmacy initiatives for healthcare reform into 3 major buckets. The first being that pharmacists could improve quality and safety of medication use. We've talked about this a lot already in our course. We know that every year we have over 1.5 million preventable adverse drug events. We know that we spend $290 billion a year on avoidable costs due to inappropriate medication use, and that things like medication non-adherence alone costs our healthcare system about $100 billion a year. We know, we have research that tells us that pharmacists getting involved in more kind of intense patient care services can improve the quality and safety of medication use in terms of these parameters we've just described. Secondly, they talk about assuring patient access to needed medications and pharmacy services. We know that we are the 3rd largest number of healthcare providers. We know that we are located in places where patients can get to us relatively easy in the community, as well as clinics and hospitals. And we know that we require compensation for the services pharmacists are getting if that access is to be maintained. So we are advocating for not only compensation for the product that is being given to the patient, but compensation for the services as well, so that access can be improved and maintained. And then finally, they talk about promoting pharmacy and health information technology interoperability, meaning that pharmacists to practice at the top of their license to provide this improvement in quality and safety of medication use must have access to information. So you must have access to patient health information to be able to not only help the patient, but practice in the collaborative team in a meaningful way as well. Well, we've got several kind of key documents that kind of support the need for bigger roles for pharmacists. We talked about the Surgeon General's report and then the Principles of Pharmacy for Healthcare Reform. I want to read one more piece from that Surgeon General's report as we go into this definition of provider status. So they say in that document that pharmacists can do many things. They are currently, in some contexts, performing patient assessments. They have prescribing authority in certain situations. They order, interpret, and monitor laboratory tests. They formulate clinical assessments and develop therapeutic plans. They provide care coordination and other health services for wellness and prevention of disease. And they develop partnerships with patients for ongoing follow-up care. And then finally, they say this: for pharmacists to continue to improve patient and healthcare outcomes as well as sustain various roles in the delivery of care, they must be recognized as healthcare providers by statute via legislation and policy, and be compensated through additional mechanisms commensurate with the level of services provided and with other practitioners providing comparable services. So, we've laid the groundwork through some of these documents I've just shared with you, and actually throughout this course, in terms of how the scope of practice for pharmacists has changed, what they're doing currently is changing, and the trajectory for the future looks even more change ahead. So let's go ahead then and define what this means, this provider status. What does it really account for? And as you can see on this slide here, this simply means inclusion of pharmacists in Section 1861 of the Social Security Act, which means that they are then eligible for Medicare Part B and reimbursement. This means if I provide patient care to you as a patient beyond the product, that I can be paid for doing it. It sounds quite simple. But this inclusion in the Social Security Act or other similar kinds of legislation this isn't the only piece that could impact this. Implying that we could be eligible for Medicare reimbursement, which is huge, but also that tends to have ripple effects in other kinds of reimbursement through other kinds of insurance. So you can see that being a provider provides not only the ability to practice in a different way, but the ability to be compensated for that care, which means access to patients will improve. So this is provider status, and you can see that it was in green, and we'll define that for you as our pharmacy fundamental here at the end of this module. So finally, let's think about some APHA and ASHP discussions around provider status. You see that APH calls this the smart spend that pays. They talk about pharmacists being able to practice at the top of their license. They focus on federal sector as well as state and private payer systems. So we got to think about the federal thing with Social Security, but we got to think about what's happening in the states as well as in private insurance situations. And that this improves patient access, it improves quality of care, and it helps decrease costs. They call it achieving value recognition and compensation for pharmacist services. APHA is making a major investment in this project. $1.5 million being invested. So, they're very serious, and they see great implications for this in terms of your future in this profession. ASHP, another group that we've studied during this course, the American Society of Health System Pharmacists, says that pharmacists should be recognized as providers because the healthcare reform stresses team-based care, that pharmacists already provide patient care services. You met, for example, Jaime Capistani in week 4 of our course. He runs a pharmacist-managed anticoagulation clinic, and that's a good example of what they're talking about. It says that pharmacists have proven their value as medication use experts, and this has been done systematically across the United States through our hospital practices, through things like patient care rounds. They say that pharmacists have more pharmacology training. On average, our pharmacy students get at least 2 years of pharmacology training, more than any other health professional. And that pharmacists providing patient care services simply saves money. We learned that earlier in our course as well. So let's think about the pharmacy fundamental of provider status. This is recognition of specific health professionals as patient care providers in the U.S. Social Security Act, which is required for reimbursement under Medicare. Here's the discussion forum question I'd like you to think about this week in terms of this module, and that is, advocating for the recognition of pharmacists as providers is a top priority of our national associations. What implication does this have for the profession of pharmacy? I'd like to hear what you have to think about that one. It's a significant question. I'll see you next time.